Hi guys, I thought it's time we had a little bit of a vlog, given the fact that in the UK we're coming out of the second lockdown tomorrow. I come from a budget hotel near my hospital. You might think, hang on a minute, why are you staying in a hotel? Well, I actually moved house just the other week, and where I'm staying is too far from my current hospital, so I'm hoping to move hospitals. But in the meantime, I'm still working back in Essex, and yeah, I'm currently on nights, and you really don't want to be doing long drives after doing the night shift. It's pretty knackering. This is actually my 4th shift out of 4, so it gives me a chance to upload this video tomorrow, and I thought it's a good time just to show you what's happening on the ground and give you some of ideas that how myself and some of my colleagues are feeling given how everything's going on. Just as a kind of bit of a good, bad and ugly news roundup, the good is so much promise on the vaccine. Hopefully I can talk a little bit about that later on. The bad, I was reading about the UK. We've not done a good job in this. I've heard that we've spent the most money and had the worst outcomes compared to other places around the world, because I think there's been a lot of mismanagement at a governmental level, lots of confusing messages. Now we're having this kind of tier system introduced as well. The message just keeps changing, which is so difficult for people to understand. And the ugly, or should I say bizarre, my sister sent me a news article about a researcher who'd shown that you could tell when COVID started coming in because scented candles started having more negative reviews, because as we know, one of the key possible symptoms of COVID-19 is a change in smell and taste. So people were smelling these candles going, these aren't working. Crazy what this big data could show us. So it is 8:15 now, the shift starts at 10. It's my least favourite shift, 10 till 8 in the morning, because then, you know, it's the proper night shift and you have to attend the handover in the morning. So hand over to the bright, sparkly-eyed people of the day shift where you look like a zombie. So I'll bring you along today and we'll talk about what we're seeing on the ground and how that has changed maybe from the first wave. It hasn't changed an awful lot, but we'll talk about that, and yeah, let's see what happens on the shift. Also, one thing I am glad about second lockdown ending tomorrow is I can get a blooming haircut. Look at this mop. So it's 20 to 10, that gives me just enough time to get into my scrubs and check into the consultant in charge and get the shift started. I've said it a lot of times on the vlog, but at this point you just have to put everything out of your mind and try and be as positive you can, do the best job for the people in front of you. And you know what? I've learned that off lots of people. It makes you feel so good when you come into work and someone gives you a huge smile. I had a bit of a tough day coming into the first shift, and when I walked into work, 2 of the nurses gave me this huge smile as I came to collect my scrubs. It kind of shone through their masks, you know, the old smiling with your eyes these days. Yeah, it makes such a difference. And you know, that kind of positivity is contagious. A bit of a funny word to use in a pandemic, but absolutely, it filters through to all the other staff members and most importantly to the patients too. So I'm going to crack on with the shift and I'll check in with you halfway through. So the time is 3:30. Shift's going well. I thought I'd talk about what many of you think I'm doing day to day as an emergency doctor during a pandemic and what it's actually like at the moment. Given the fact we're in a second wave, you probably think we're seeing every other patient is coming in with shortness of breath due to COVID-19, and we're all in full PPE the whole time with the respirator masks and goggles and the gowns like you're seeing on the TV. But actually that's just not the reality at the moment. The second wave is definitely more of an insidious one. Fewer patients, but things are definitely mounting up. The first one, you know, certainly from my point of view, was definitely came on to us a lot quicker. But that's important to say as well, that that's just my point of view. Given this random nature of how COVID-19 spreads via this super spreader thing, means we're going to get very different patterns of spread in different areas, which is kind of why we're doing this tiered lockdown, isn't it? And individually we're having much different experiences, all of us doctors would. Like, I spoke to one of the medical doctors yesterday who was the one seeing all the new COVID-19 patients coming in, and she basically said that, you know, everyone she sees has COVID-19, and so she has a much different view from what I have. So today I don't think I've seen any patients with COVID-19, but obviously I have to wear sort of universal PPE because, as we know, patients with COVID-19 can be asymptomatic. So what am I doing in the emergency department? Well, admissions are down, so we're seeing fewer patients than we normally do, and that's, I think, because patients are staying away, rightly so, and accessing health services in a different way given the pandemic. And also I think lockdown, people tend to do less things that, you know, to injure themselves, to bring them into the emergency department. By far the most kind of common things we're seeing is the common things we'd always see this time of year. So the elderly and frail having, you know, falls or complications from other comorbidities, so infections, heart attacks, strokes. We're seeing lots of mental health, and we're seeing lots of social admissions too. And we're still seeing some injuries as well. Maybe people still doing things they shouldn't given the fact we're in a lockdown. But the COVID-19 patients that I am seeing, what's different between this and the previous lockdown? Well, people are much more aware of what's going on. So before, when I came in, I remember talking to people when they, you know, telling them I think they've got COVID-19, and they were really shocked and scared because of what they were reading about this virus. Whereas now people tend to already know they have COVID-19, so they've already had the positive test, generally, you know, a week before they come in to see us. And things have progressed because they're, you know, had this secondary kind of immune reaction to it. So they already know they have COVID-19, but then develop, you know, shortness of breath or chest pain or other problems, and then they'll come in to see us. So a very different kind of thing that people know what's going on. And I think a lot less scared than they were before because we're understanding things a little bit more. Although we're not seeing these huge rushes of patients that perhaps we saw more in the first wave, that doesn't mean there isn't a huge strain on the NHS, and we have a huge strain during the winter months anyway. I believe our ICUs are currently full, not just at my hospital, but the hospitals in the area. And you think, well, how can they be full given we're not having too many COVID patients come in? Well, because COVID patients, they end up staying on the ward or end up staying on ICU for a long amount of time. So they need that bed to be ventilated. Therefore, that's why I said this second wave is much more of an insidious thing. So although the lockdown's ending tomorrow, that doesn't mean that the second wave ends tomorrow. This lockdown has just helped ease things, so, you know, just to keep on top of it. So again, if you speak to anyone in ICU, they'll give a much different picture to what I'm experiencing. One thing I did want to mention on this video that I touched upon at the start of this was the vaccine. So many medical professionals I speak to are super excited about this, you know, being part of the battle in ending this fight with COVID. And they're very optimistic. I think none of us could believe that, you know, 90% efficacy in the early trials, we'd get close to that with a virus of this nature, just because, you know, we haven't managed to crack it with like the common cold or SARS before it. So this is a fantastic breakthrough. So huge shout out to all the researchers that have been involved in that, and not just the trials that have been successful, all the other trials that have, you know, been trying to get to where we are. I actually did a talk with Dr. Jenkins last week, which I'll put on the channel in the next couple of days, and he was very optimistic as well, but did say, you know, we do need to reel in our expectations a bit. And I kind of get that, because what we don't want to do is then just suddenly forget everything else we're doing, thinking this vaccine is going to save things. I think that's the general message, but, you know, people are still very optimistic about where we are with the vaccine, which is great. And on that as well, like, already we've had emails from my hospital, and I think we're going to be seeing this vaccine very soon, in the next couple of weeks, I think, which is just crazy. One of the other big barriers to this vaccine is obviously education and making sure people are aware of the benefits of the vaccine. We've seen it in other things. I think the anti-vaxxer movement is unfortunately kind of a growing thing on the internet. Let's not beat around the bush. There will be potential side effects to this vaccine, but look at what you're trying to prevent. COVID-19 is a potential fatal disease, and you may think, well, most people are asymptomatic and most people don't develop problems, but even in young, fit, healthy people, there is a very small number of people that can die from it, but also a large number of people that can have long-term problems, so this so-called long COVID. And it may be that some of the side effects look potentially bad, but you read any side effects to even things like paracetamol, which many of you probably take, you read the side effects to them and you realize, blimey, you might never want to take it again. we're very bad at assessing risk when we hear about these catastrophic things that can happen when we take these medications, but they go through such rigorous testing. You know, and you've got to put it in perspective of how bad the actual illness is. A kind of interesting story about long COVID as well. During the first wave, I remember seeing a few patients come in that had COVID-19 and were having fatigue, chest pain, shortness of breath, kind of ongoing weeks later. I remember saying to my consultant I've seen a few of these patients, you know, what are we putting it down to? And it was just, you know, a post-viral cough or costochondritis. You know, we put it down to a post-viral type of syndrome. And I remember there's not an actual way to code that, so to actually write the diagnosis in our computer system. And it was so interesting that like a couple weeks later, long COVID kind of came out in, you know, the research. So it's very strange for me as a doctor to be seeing something for the first time before it's even really been documented about. So that was a first for me. Okay, so I've got a few hours left on the shift. I'm gonna crack on with it and I'll give you a quick update at the end. Bye. That must be what it's like to take a bra off. Pretty good shift overall. In terms of COVID, I saw 3 patients with respiratory type infections. You know, outside of this pandemic, you know, you'd really put that down to a bacterial infection, maybe even something like the flu. They didn't quite fit the COVID picture for me, but obviously we don't know, so those patients will have to have a test, and in the meantime go to one of our amber wards, and if the test is negative, then obviously they'll go to a green ward, and if the test is positive, they'll go to one of the red wards. So yeah, that's kind of what we're seeing then in the pandemic at the moment. Hopefully that's given you more of an idea of what this kind of strain on the hospital is. So it's very much on those patients on the ward and on ICU, and other parts of the NHS are having to adapt to do all the things we normally do in a safer way as possible. So thank you again for watching. Thank you again for all the support. I hope you're all well. So next up for me is getting this barnet chopped. My hair is so long. One of the benefits of doing nights is you then have the whole day to do stuff. I mean, obviously that does involve sleep. So until next time guys, take care of yourselves and I'll see you soon.